We are so excited to be here today at the Health 2.0 Conference 2023. Please introduce yourself and the organization you're representing today.
Hi, I'm Dr. Julie Harrigan. I am here representing my own company, Physician EHR Solutions. It's a company that I formed about a year ago, just finished the website a couple months ago, as those things go. And I do clinical advisory for large and small healthcare systems on how to implement their electronic health records, how to best comply with regulatory standards, qualities of care, and then and how to integrate all of that into the physician and clinician workflows.
That's amazing. You are a Health 2.0 Conference USA Summer 23 honoree. How does it feel to receive recognition for your accomplishments?
You know, it's absolutely so flattering. I didn't even know that somebody was looking to give me an award until they contacted me. And, you know, I've worked so hard in this industry, going on almost 14 years now in the healthcare informatics. And it's really something that I'm very passionate about. And to be recognized for all of those efforts and the things that I've been able to do from a leadership perspective is just, it's an amazing honor.
That is so awesome. What advice would you give to someone wanting to follow in your footsteps?
Oh, make sure this is what you want to do. I'm a physician. I still see patients. I still, round on my patients. I still talk to families. I do, anything from hospitalists to hospice and palliative care, in addition to my duties, advising these large healthcare systems. And for so many reasons, least of which is the fact that if I'm not in the trenches and don't know what's going on in my hospitals and with our patients and in healthcare, then how could I ever advise people to do what I do? And so I think my advice for people going into this field, especially as a clinical informatics advisor or a clinical informatics, if you want to be a CMIO, that you still have to practice medicine. If you can't relate to your patients, if you can't relate to what's going on in the trenches, if you can't get your hands dirty, for lack of a better term, then you're not going to be at the top of your game. And so it's great to know the computer systems and how they work and become a builder and do all of these things. But if you really want to make an impact on the healthcare systems, if you really want to touch your doctors and let them know that you're with them and that although things can get rough, you've been there and done that, and really relate to them on just a really collegial basis, go to work. Go to work, see your patients, work in the hospitals, work in the clinics.
That's awesome. How has your learning and networking experience been so far at the Health 2.0 Conference USA Summer 23?
Actually, surprisingly awesome. It's sometimes at conferences, because I get so into whatever's going on that I'll tend to keep my head down and not talk to as many people. But there's so many people here that I can just easily relate to. Everybody is in it to improve it, right? I think we're in it for our businesses. We're in it for our, especially at the Health 2.0 Conference, we're in it for the healthcare systems. We're in it to improve, anything from nutritional initiatives to physical fitness to technology and all of these different facets. And it's such a wonderful multidisciplinary group that I'm intrigued by the people around me, and I've gathered more cards in the last, I don't know, how many hours have we been here, since 8:00 in the morning, than I've gathered at any other conference that I've ever been to. So it's really been fantastic. I'm looking forward to the next couple days.
Amazing. Where can others reach you for collaboration and advice?
Oh, okay. So I finally have a website. I got it. I bit the bullet and got it done for this conference. So my website is physicianehr.com, or you can just put ehrmd.com. My cell phone is on all of my cards, so my direct line is there, and my direct email, which is jharriganmd@mdehr.com. They can reach me anytime.
Well, thank you so much for your time. It was a pleasure talking to you.
It was a pleasure. Thank you very much.